Okay, next. Number 60, which of the following is considered an artifact on drying of blood film? Choices: is it letter A, acanthocytes, letter B, echinocytes, or letter C, spherocytes, or letter D, stomatocytes? Again, which of the following is considered an artifact on drying of blood smear? So, a blood smear or blood film. So, I mentioned earlier that echinocytes can be seen in pyruvate kinase deficiency or uremia po, or it may exist as an artifact due to the alkaline glass effect. For number 60 po, we have letter B, echinocytes. Again, for number 60, letters. Next, number 61. The area in the automated cell counter histogram represents the RBC distribution curve. Okay, so given the following histogram, is it letter A, letter B, or is it letter C? So in choice letter A, that's 90 to 250 fetoliter. Again, 90 to 250 fetoliter po yan. And choice letter B po, that's around 50 to 200 fetoliter po. Sa choice C naman, okay, that's around 5 to 20 fetoliter po. Now remember po, okay, yung mga normal histogram values po. So the WBC histogram provides a count and plot of cells in the WBC aperture, but remember that the normal WBC histograms po range from 45 or larger than 45 po, 45 to 450 fetoliter po. Okay, and we have also RBC histograms, tama po ba? RBC histograms naman represent cells counted in the RBC dilution in the size range of 36 to 360 fetoliter po, which are sorted and plotted as frequency against cellular volume. Again, normal value po sa RBC histogram is 36 to 360 fetoliter. And we also have for platelet po. Platelet histograms naman, they represent cells in the RBC counting baths that are in the size range po of 2 to 20 fetoliter po. Now, sa choices, okay, ano yung answer natin? Okay, we have letter B po. Again, letter B po yung answer. Sorry po, nakalagay po na check is letter C, but that's supposed to be letter B po, yung check. Again, letter B po yung answer, letter B. As you can see, it is made up of a single peak. Okay, one way po na malaman natin kung WBC siya or RBC. Sometimes po, yung values nila almost the same. But remember po, RBC histograms are usually made of only a single peak po. Normally, the peak of this RBC histogram po should be around 70 to 110 fetoliter po. Tapos, yung WBC, kung makikita nyo po, ay may tatlong peaks po. So, choice letter A is true for WBC. Again, notice the 3 distribution peaks. Choice letter B is true for RBC histogram. And choice letter C, again, choice letter C po, is true for... Next, for number 62. The area in the automated cell counter histogram represents the platelet distribution curve. Again, so given that, A, B, and C, ang tamang answer po natin is letter C again. So that's 5 to 20. Again, the normal RBC histogram po is around 2 to 20 fetoliter po. Number 62, letter C po. Next, which of the following will cause a decrease in ESR reading? Again, which of the following will cause a decrease in ESR reading? Is it letter A, delay in testing, letter B, high room temperature, letter C, tilted ESR tube, or letter D, vibration? Again, decrease in ESR reading, correct answer is letter A, delay. ESR, just a recap. Okay, so the principle behind this, it measures rate of fall of red cells through plasma po. So relatively mas mataas po sa female, which is around 0 to 20 mm per hour, and for males, that's 0 to 15 mm per hour. Now, clinical correlations po, increased ESR is usually seen in the presence of abnormal plasma proteins po, like inflammatory state. And also sources of error. Increase in ESR, we have tilting of the tube, standing too long, increased temperature, excess EDTA. And for decreased ESR naman po, we have quantity not sufficient specimen and decreased Okay, for number 64, a 62-year-old patient presents to the physician with report of increased thirst and increased urination, particularly at night. Now, the physician requests a series of tests over the next few days. The following data are received. Now, given the values, random glucose is 186 mg per dl, fasting glucose is 114 mg per dl, 2R OGTT is 153 mg per dl, and glycosylated hemoglobin is 5.9%. Now, the normal value for resting plasma glucose is less than 140 mg per dl. Fasting plasma glucose is less than 100 mg per dl, 2R OGTT is less than 140 mg per dl, and normal glycosylated hemoglobin is less than 5.7%. So question, which of the following conclusions may be made regarding these data? Letter A, data represents normal glucose status. Letter B, data represents an impaired glucose status. Letter C, data represents the presence of insulinoma. Or letter D, data represents diagnosis of diabetes. So the correct answer is letter B. Again, data represents an impaired glucose. Now, take note the given values are for random glucose, that's 186 mg per dl. For the fasting glucose, that's 114 mg per dl. For the 2R OGTT, that's 153 mg per dl. And for glycosylated hemoglobin, that's 5.9%. All of the following values fall under impaired glucose status. Next, the American Diabetes Association set a diagnostic criteria for diabetes mellitus. Now, hemoglobin levels of greater than or equal to 6.5% is diagnostic criterion for diabetes. Fasting plasma glucose of greater than or equal to 126 mg per dl, a random plasma glucose level of greater than or equal to 200 mg per dl, and lastly, 2R plasma glucose level of greater than or equal to 200 mg per dl. Number 65, Cushing syndrome is associated with letter A, hyperglycemia, letter B, hypoglycemia, letter C, normal blood glucose, letter D, variable blood glucose. The correct answer is letter A. Next, turbidity in the serum suggests elevation of what? Again, turbidity in the serum suggests elevation of what? Is letter A, cholesterol, letter B, total protein, letter C, chylomicrons, or letter D, albumin? Okay, turbidity po. Correct answer is letter C, chylomicrons. Again, for number 6, microns. Next, 67. Which of the following lipoproteins is the smallest of the lipoproteins and is composed of 50% protein? Again, which of the following lipoproteins is the smallest of all the lipoproteins composing of 50% protein? Is it letter A, HDL, letter B, chylomicrons, letter C, LDL, or letter D, triglyceride? For number 67, that's letter A, HDL po. Again, letter A, HDL. So remember, HDL is the smallest but most dense, okay? Also known as the protein-rich lipoprotein. While chylomicrons naman, siya yung largest but least dense. Remember, it is made up of 80 to 95% triglycerides. So that's why tawag sa kanya is triglyceride rich lipoprotein. LDL, on the other hand, is made up of around 50% cholesterol esters and is also, remember, a primary marker for coronary heart disease. And lastly po, okay, by the way, LDL transports cholesterol to peripheral tissue po. So yan, 67. Okay, for number 68, which of the following renal conditions is associated with recent group A beta hemolytic streptococcus infection? Again, which of the following renal conditions is associated with recent group A beta hemolytic streptococcus infection? So the choices, is it A, kidney obstruction, letter B, acute renal failure, letter C, uremic syndrome, or letter D, acute glomerulonephritis po? Ano yung answer natin? That's letter D, acute glomerulonephritis. So remember, streptococcal glomerulonephritis is caused by the antigen-antibody complex deposits in the. Next, in which of the following disease states would you see an elevation in total bilirubin and conjugated bilirubin only? Again, pa-highlight naman po ng total bilirubin and conjugated bilirubin. Again, in which of the following disease states would you see an elevation in total bilirubin and conjugated bilirubin only? Is it letter A, hemolysis, letter B, neonatal jaundice, letter C, hepatitis, or letter D, biliary obstruction? Again, in which of the following disease states would you see an elevation in total bilirubin and conjugated bilirubin only po? Correct answer is letter D, biliary obstruction. Again, pa-highlight po. So, yan po. Okay, just a summary. Okay, so for bile duct obstruction sa post-hepatic phase or okay, as seen in obstructive jaundice po. Okay, yan. Increase po yung direct bilirubin sa blood. Okay, at positive po yung conjugated bilirubin sa urine and decrease naman po yung urine urobilinogen po. Now, for hemolytic disease, okay, so sa pre-hepatic phase, increased indirect bilirubin sa blood, negative for urine bilirubin, and positive for urine urobilinogen. And for liver damage, na nasa hepatic phase, that's increased indirect bilirubin or direct bilirubin, negative urine bilirubin, and positive. Okay, for number 70, adrenal Cushing syndrome. Okay, which is true for adrenal Cushing syndrome. Is it letter A, increased cortisol and ACTH? Letter B, decreased cortisol and ACTH. Letter C, increased cortisol and decreased ACTH. Or letter D, decreased cortisol and increased ACTH po. So, yan po. Correct answer po natin is letter C, increased cortisol and decreased ACTH po. So, remember po, okay, since cortisol production po by the adrenal glands is normally under the control of the pituitary, overproduction po can be caused po by a tumor in the pituitary. Okay? Or within the adrenal glands themselves. Parang sa adrenal Cushing syndrome po. Correct answer po is increased cortisol, again, decreased ACTH. So when a tumor naman, pituitary tumor, secretes too much ACTH or adrenocorticotrophic hormone, it causes the otherwise normal adrenal glands to produce too much cortisol po. This type naman po sa pituitary tumor po, this type of Cushing syndrome is termed Cushing's disease, and it is diagnosed just like other endocrine disorders po. So in this case, pag sa Cushing's disease naman po, serum cortisol will be elevated and serum ACTH will also be elevated. Number 70, we have letter C. Okay. Again, choice letter A po, increased cortisol and ACTH po, okay, is characteristic of Cushing's disease naman po, due to pituitary lesions. Okay, next, number 71, levels of this analyte rises rapidly after myocardial infarction, but this finding is relatively non-specific. Pa-highlight naman po ng non-specific and rises rapidly. Okay, we have, is it letter A, myoglobin, letter B, troponin, letter C, creatine kinase, letter D, lactate dehydrogenase. For number 71, okay, correct answer is letter A, myoglobin. Next. Okay, 72. Which of the following tests may be ordered to assess the toxic effects of acetaminophen? Again, which of the following tests may be ordered to assess the toxic effects of acetaminophen? Is it letter A, amylase and lipase? Highlight po ng acetaminophen. Is it letter B, AST and ALD? Letter C, BU and creatinine, or letter D, CK and LD? Again, which of the following tests may be ordered to assess the toxic effects of acetaminophen? Correct answer po is letter B, AST and ALD po. Okay, next, phenobarbital is a metabolite of blank. Again, phenobarbital is a metabolite of, okay, choices, letter A, amobarbital, letter B, phenytoin, letter C, primidone, or D, secobarbital. Again, phenobarbital is a metabolite of, okay, letter C, primidone po. Again, primidone po is an inactive form of phenobarbital po. Primidone is used to treat generalized tonic-clonic simple partial and complex partial seizures. So yan po. Phenobarbital po, yung metabolite niya po. Okay, phenobarbital is the metabolite of primidone. Sorry, again, phenobarbital is the metabolite of primidone. We have NAPA. NAPA naman po is the metabolite of procainamide. And we also have benzoyl ecgonine, which is the metabolite of cocaine. Next, for procainamide, this is used for the treatment of cardiac arrhythmia. And phenytoin naman po is used for the treatment of seizures po. Next, the drug procainamide is prescribed to treat cardiac arrhythmia. What biologically active liver metabolite of procainamide is often measured simultaneously? Again, the drug procainamide is prescribed to treat cardiac arrhythmia. What biologically active liver metabolite of procainamide is often measured simultaneously po? So is it letter A, lidocaine, letter B, NAPA, and acetylprocainamide, letter C, phenobarbital, or letter D, quinidine po? Again, for number 74, drug procainamide is prescribed to treat cardiac arrhythmia. What biologically active liver metabolite is often measured simultaneously? Correct answer is letter B, NAPA po. NAPA is the active hepatic metabolite of the parent drug. Okay, number 75, the trough level for therapeutic drug monitoring is collected. Again, the trough level for therapeutic drug monitoring is collected. Letter A, 30 minutes after the medication is administered. Letter B, 30 minutes before the medication is administered. Or letter C, at the time specified by the manufacturer. Or letter D, after the patient has fasted for 8 hours. Again, trough level po. Answer po is letter B, 30 minutes before the medication is administered. Now, trough levels po, remember, are monitored to ensure that levels of the drug stay within the therapeutic range. Again, within po the therapeutic range. And trough level specimens are the easiest to collect because they are collected when the lowest serum concentration po of the drug is expected po. Usually po, immediately po yan bago yung administration ng next scheduled dose po. Peak levels, on the other hand, screen for drug toxicity and specimens are collected po when the highest serum concentration po ng drug is anticipated. So, yung peak times po can be influenced po by several factors po. But typically po, it happens 30 minutes after IV administration, 60 minutes after IM, and 1 to 2 hours po after oral intake. Kaya sinasabing, okay, careful coordination of sample collection with dosing is critical po. For number 75, next 76, if the total bilirubin is 3.1 mg per dl and the conjugated bilirubin is 2 mg per dl, the unconjugated bilirubin is, again, if the total bilirubin is 3.1 mg per dl and the conjugated bilirubin is 2 mg per dl, the unconjugated bilirubin is it letter A, 0.5 mg per dl or 8.6 micromoles per liter, letter B, 2.2 mg per dl or 3.76 micromole per liter, letter C, 1.1 mg per dl or 18.18 micromoles per liter, or letter D, 5.1 mg per dl or 87.2 micromoles per liter. Again, given po yung total bilirubin. Okay, that's 3.1 mg per dl. Conjugated bilirubin naman po is 2. So, ang unconjugated bilirubin po is letter C, 1.1 mg per dl. So, that's total bilirubin is equals to, remember, the conjugated bilirubin plus the unconjugated bilirubin po. So, ang nangyari is 3.1 minus 2. So, we get 1.1 mg per dl or 18.8 micromoles per liter po. Next, 77. When measuring serum bilirubin, the purpose of adding caffeine sodium benzoate or methanol, okay, in the reaction is, okay, ano yung purpose nito? Choices, is it letter A, accelerate the reaction with conjugated bilirubin? Letter B, accelerate the reaction with unconjugated bilirubin. Letter C, destroy excess diazo reagent. Or letter D, shift the wavelength absorbed by azobilirubin. Again, pilot po ng caffeine, sodium benzoate or methanol po. Correct answer is letter B, accelerate the reaction with unconjugated bilirubin po. So, unconjugated bilirubin is poorly soluble in aqueous solution po. Okay, it reacts very slowly with aqueous solution of diazotizing color reagent unless an accelerating reagent po. Again, accelerating agent po si caffeine sodium benzoate po sa Gendrasik and Groff or methanol naman po. Okay, isang accelerating agent naman po sa Evelyn Maloy po si methanol. Okay, so for number 77 po, that is letter B po. Next, for number 78, which of the following compounds can interfere with colorimetric chloride assay? Okay, colorimetric chloride assay. Is it letter A, acetoacetate? Letter B, ascorbate? Letter C, bromide? Or letter D, nitrate? Again, which of the following compounds can interfere with the colorimetric chloride assay? Is it A, acetoacetate? Letter B, ascorbate? Letter C, bromide? Or letter D, nitrate po? Correct answer is letter C, bromide. So remember, chloride assays po are based upon either colorimetric or chemical titration po. Okay, subject po yan sila sa positive interferences po from other anions or electronegative radicals po. So, aside from bromide, we have also cyanide and cysteine po. So, these include other halogens po. Again, bromide, cyanide, and cysteine. Again, keyword po natin is colorimetric chloride assay. For number 78 po, that's letter B. Next, hepatocellular damage may be best assessed by, okay, choices. Is it letter A, serum AST and ALT? Letter B, GGT and ALP? Letter C, bilirubin, GGT and ALP? Or letter D, ammonia and urea po? Again, take note, hepatocellular po yan. So, ang correct answer po natin is, which is specific sa liver, serum AST and ALT po. Okay, pag ang tanong naman, hepatobiliary damage, ALP naman po and GGT. Again, hepatobiliary damage po for ALP and GGT po. Number 79, that's letter A. Next, which of the following analytes is the best indicator of hepatobiliary damage? Again, is it letter A, AST, letter B, ALT, letter C, ALP, or letter D, bilirubin po? Again, which of the following analytes is the best indicator of hepatobiliary damage po? Correct answer is letter C, ALP po. Again, letter C, ALP. Now, for number 81, so the highest serum ALP activities, that's 10 to 25 times the upper limit po, are found in patients with anong condition? Is it letter A, hyperthyroidism? Letter B, osteomalacia? Letter C, Paget's disease or ostitis deformans? Or D, rickets po? Again, highest serum ALP activities po are found in patients with Paget's disease po. So, most common cause po ng increased ALP po ay liver po or bone disease po. So, disorders po causing cholestasis more frequently cause elevation of ALP po than other liver diseases po. So, increased osteoblastic activity. Remember po sa Paget's disease, also sa tumor, metastatic to bone and metabolic bone disease po. Ang most common cause ng elevated elevated ALP po. For number 81, letter. Next, number 82, primary hyperparathyroidism. Again, primary hyperparathyroidism most often results from parathyroid adenoma po or hyperplasia. Ano kayong answer natin dito? Is it letter A, increased calcium and phosphate? Letter B, decreased calcium and phosphate? Letter C, increased calcium, decreased phosphate. Letter D, decreased calcium, increased phosphate po. Okay, primary hyperparathyroidism. Correct answer is letter C, increased calcium and decreased phosphate po. So, primary hyperparathyroidism po, or also sa mga cases po ng malignancy po, increased ang calcium but decreased ang phosphate po. So, but if calcium increase po is due to renal failure po, okay, phosphate values po also rise po. So, both calcium and phosphate values are elevated po sa mga conditions like multiple myeloma or pag na-overdose ng vitamin D po. Also in bone cancers po. Now, primary hyperparathyroidism, pagka sinabi ko kanina, most often results from parathyroid adenoma or hyperplasia po. Now, additionally, hyperparathyroidism po can be associated with other endocrine disorders po. Okay, collectively referred to as yung tinatawag nating multiple endocrine neoplasia po. It involves the pituitary, pancreas, thyroid, and adrenal glands po. So, serum calcium is increased, PTH is increased, and phosphorus is normal to decreased po in primary hyperparathyroidism po. Now, sa secondary hyperparathyroidism naman po, okay, secondary hyperparathyroidism naman po is a condition associated with an attempt for the body to compensate for hypocalcemic states po. So, commonly po nakita po yan sa mga pasyenteng may renal failure po who cannot excrete phosphorus po. And that results in a decrease in calcium po, which stimulates the secretion of the parathyroid hormone po. So, pagdating sa secondary hyperparathyroidism po, serum calcium po is low, PTH is increased, and phosphorus po is increased po. Again, for secondary hyperparathyroidism po, decreased po ang calcium, increased naman po ang phosphate po. Okay, for number 83, increased calcium and phosphate po. Anong condition associated? Is it letter A, malignancy, letter B, hyperparathyroidism, letter C, multiple myeloma, or letter D, all of these po? Again, increased calcium and phosphate po. Again, increased calcium and phosphate po is associated with multiple myeloma po. Sinabi ko kanina, if calcium increase is due to renal failure po, yung phosphate values po ay tataas po. Both calcium and phosphate values are elevated po in cases of multiple myeloma po and vitamin D overdose po. As well po as in cases of cancers that metastasize the bone. For Next, number 84, valinomycin enhances the selectivity of the electrode used to quantitate. Okay, is it letter A? Anong incorporate sa electrode na to? Okay, is it calcium? Letter B, chloride. Letter C, potassium. Or letter D, sodium. 84, letter C, potassium po. Again, for number 84, letter C, potassium po. So, analyzers fitted with ISE contain potassium electrodes po with liquid ion exchange membranes po that incorporate valinomycin po. It is a carrier, an ionophore, a neutral carrier po that binds potassium in the center of a ring of oxygen atoms po. Okay, so just a recap. Ano ini-incorporate sa ISE membrane? Okay, anong purpose ng glass aluminum? Ano naman sa glass aluminum silicate po? That's sodium. For valinomycin gel, potassium po. Organic liquid membrane, ion exchangers, we have calcium and lithium, gas and enzyme electrodes to include nonactine and monactine for ammonium ions po. Next, for number 85, most reference electrodes contain a high concentration of blank internal solution used to produce the reference potential. Again, most reference electrodes contain a high concentration of internal solution used to produce the reference potential. Choices, is it letter A, potassium chloride, letter B, potassium hydroxide, letter C, sodium chloride, or letter D, sodium hydroxide po? The correct answer is letter A, potassium chloride po. Most reference electrodes po contain a high concentration of potassium chloride internal solution po that is used to produce the reference potential. For number 85, letter Now, for number 86, which salts are frequently administered to patients with preeclampsia? Again, which salts are frequently administered to patients with preeclampsia? Is it letter A, chloride, letter B, iron, letter C, magnesium, or letter D, sodium? Again, which salts are frequently administered to patients with preeclampsia po? Okay, letter C po, magnesium. Magnesium salts po are usually po ginagamit po yan siya or ina-administer sa mga pasyenteng may anti-arrhythmia, okay, or any other neuronal actions po. And to patients din po with preeclampsia po, also sa ischemic heart disease and MI po. So remember that monitoring po ng free magnesium concentrations has been suggested po because both low and high concentrations po of magnesium can also be life-threatening po. For number 86, letter C po. Okay, next, for number 87, what is the effect of oral contraceptives on iron po? Again, what is the effect of oral contraceptives on iron? Is it letter A, high, letter B, low, letter C po, normal, or letter D, variable? Okay, for number 87 po, correct answer is letter A. Remember po that high values of iron may elevate also TIBC po. Again, high values for iron may also elevate total iron by. Now, before we go to number 88, let's look at the normal values of the blood gas parameters po. pH, okay, measures hydrogen ion concentration, remember. So the reference range po is around 7.35 to 7.45, or on average po, that's 7.40 po. PCO2 naman po, measures of course partial pressure of carbon dioxide po. And the normal range po is 35 to 45 mmHg po. Now for PO2 naman, that measures partial pressure of oxygen po. So ang normal value po is 80 to 100 mmHg. And we have also for bicarbonate, of course, measures bicarbonate levels po. The reference range naman po is 22 to 26 millimoles per liter po. And total carbon dioxide naman po, okay, measures of course bicarbonate and carbonic acid with the reference range of 23 to 27 millimoles per liter po. Na kung mapapansin niyo po sa table sa baba, in respiratory acidosis po yan, meaning low po ang pH. And due to excess carbon dioxide accumulation. Kaya mataas po si carbon dioxide po. High carbon dioxide and normal bicarbonate po. Now, in compensation, okay, in compensation, yung ginagamit natin compensation to this is to retain the bicarbonate and excrete hydrogen po. Sa respiratory alkalosis naman po, alkalosis meaning mataas po ang pH. So, high pH plus, remember, this is due to excess carbon dioxide loss. Kaya kung mapapansin niyo, mababa po si PCO2 po. Okay, now to re-establish this 20:1 ratio po, kidneys excrete bicarbonate po and they retain the hydrogen ion po. In metabolic acidosis naman po, again, in metabolic acidosis naman po, this is acidosis meaning low ang pH po but excess po yung hydrogen due to excess hydrogen production po kaya mababa po si bicarbonate po. And the primary compensation for this is hyperventilation, of course, to blow off carbon dioxide po. And in metabolic alkalosis naman po, this is alkalosis, meaning mataas po ang pH. Again, high ang pH plus excess hydrogen loss. Kaya mataas naman po si bicarbonate. Again, kaya mataas naman po si bicarbonate. And in compensation po dito, hypoventilation po. And that is to retain carbon dioxide po. Now for number 88, Okay, increase in PCO2 in a patient most commonly results in which of the following primary acid-base abnormalities? Again, increased in PCO2 po in a patient most commonly results in which of the following primary acid-base abnormalities? Okay, is it letter A, respiratory acidosis, letter B, respiratory alkalosis, letter C, metabolic acidosis, or letter D, metabolic alkalosis po? Okay, correct answer po is letter A, respiratory acidosis po. So remember po, PCO2 po is an acidic gas po controlled by the lungs po. So respiratory po yan. Okay, respiratory system, and when it increased concentrations, this will drive respiratory acidosis po. Okay, for number 88 po, letter A. Next, number 89 naman. Which set of results is consistent with uncompensated respiratory alkalosis? Again, pa-highlight naman po ng uncompensated respiratory alkalosis po. Again, set of results consistent with uncompensated respiratory alkalosis po. Choices, is it letter A, pH of 7.70, okay, bicarbonate of 30, PCO2 25. Letter B, pH of 7.66, bicarbonate 22, and for PCO2, 20 po. For letter C naman, pH po is 7.46, bicarbonate is 38, and PCO2 po is 55. And for letter D, is it pH of 7.36, bicarbonate of 22, and PCO2 of 38 po. Again, uncompensated respiratory alkalosis. Correct answer po is letter B po. Now, remember po, respiratory alkalosis po is caused by hyperventilation po, inducing low PCO2 po. So, normal value po yan. Again, low PCO2 po for respiratory alkalosis po. So, because ang normal value po is 35 to 45 mmHg. So, mali na yung choice na letter C or letter D. Now, usually po, pagdating sa early phase ng acute disturbance or acute respiratory, disturbance, yung kidneys po natin ay wala ng time sa pag-compensate, kaya yung bicarbonate po ay within normal limits na po, ay nasa normal limits po. So, the normal value, remember, is 22 to 26 mmHg po for bicarbonate. So, saan yung pasok dyan? That's letter B po. So, yung tamang answer po ay letter B. Number 89, we have the 89 letter. Next, for number 90, which set of results is consistent with uncompensated metabolic acidosis? Again, which set of results is consistent with uncompensated metabolic acidosis? Take note, acidosis po. Okay, acidosis. Is it letter A, pH 7.25, bicarbonate levels of 15, PCO2 of 37? Is it letter B, pH of 7.30, 16, bicarbonate of 16, and PCO2 of 28? Letter C naman po, is it pH of 7.45, PCO2 of 22, or 40 mmHg po, yung PCO2 po. And we have letter D, pH naman po of 7.40, bicarbonate of 25, and PCO2 of 40 po. Okay, so sa tingin natin, ano kaya yung answer dito for number 90? That's letter A po. Why? Take note, acidosis po yan. Acidosis will manifest or show with a pH po of less than 7.35 po. So again, dapat less than 7.35. So, talagang mali na yung, okay? Mali na yung 7.45 and 7.40. So, because it is metabolic, again, yung tanong po is metabolic, it will be driven by low levels of bicarbonate po. Again, low levels of bicarbonate po. So, dito pa lang, alam na natin na yung answer po ay letter A. And remember po, because it is uncompensated, again, uncompensated condition, yung respiratory parameter po will fall within the normal range po. Again, sa uncompensated condition po, yung respiratory parameter would be in normal range. So, sining pasok dyan? That's letter A. pH of 7.25, okay, bicarbonate of 15, and pH 7. Next, 91, a patient's blood gas results are pH po is 7.50, Your PCO2 naman is 55 mmHg and yung bicarbonate po is 40 millimoles per liter. Now, these results indicate what? Okay, is it letter A, respiratory acidosis, letter B, metabolic alkalosis, letter C, respiratory alkalosis, or letter D, metabolic acidosis po? For number 91, the correct answer is letter B, metabolic alkalosis po. Again, letter B, metabolic alkalosis. So remember that a pH above 7.45 corresponds with alkalosis. Now question, saan sa dalawa? Okay, metabolic alkalosis ba or respiratory alkalosis? Okay, so kung mapapansin nyo po, both bicarbonate po and PCO2 po ay mataas. Okay, normal value po for bicarbonate, again, is 22 to 26 at yung sa PCO2 po ay 35 to 45 mmHg po. So lumampas po sila. Now, bicarbonate po is the conjugate base and is under metabolic or renal control po. So, yung PCO2 naman po is an acid and is under respiratory control. Pag mataas po ang bicarbonate, pero mababa ang PCO2, it results in alkalosis po. Therefore, the classification is metabolic alkalosis po. But remember po, partially compensated po to by increased PCO2 po. For number 91, letter B. Again, for number 91, letter B. Number 92, okay, comparing the two methods for identification of an analyte by the standard tests, 100 patients test positive. Again, 100 patients test positive po. Given, okay, sa method 1 po, 80 positives and 20 negatives. And for method 2 po, 70 positive and 30% naman po yung negative. Now, question, which is true? Letter A, same sensitivity. Letter B, same specificity. Letter C, method 1 is more sensitive. Or letter D, method 1 is more specific po. Okay, correct answer po is method 1 is more sensitive po. When we say diagnostic sensitivity, we're more on positives than negatives po. So, since mataas po yung positives ni method 1, siya po ay more sensitive po kesa kay method 2. For number 92, we have letter next, for number 93, if a test has a specificity of 98%, it results in approximately, letter A, 98% false positives, letter B, 98% false negatives, letter C, 2% false positives, or letter D, 2% false negatives. Again, if a test has a specificity of 98%, it results in approximately. Correct answer po is letter C, 2% false positives po. Yan, for number 93 po, letter C, 2% false positives. So, for specificity, more true negatives and few false positives po. So, the answer for number 94, acidic urine. Okay? Anong condition yung may acidic urine? Is it letter A, vomiting, letter B, vegetarian diet, letter C, high protein diet, letter D, renal tubular acidosis. Again, sino po sa kanila yung may acidic urine? Correct answer is letter C. Now, just in case, okay, sino may acidic urine, ano mga conditions? For example po, we have emphysema, DM, okay, starvation, dehydration, diarrhea po. And also have high protein diet, okay, medication, certain medications po, like for example, methenamine mandolate and fosfomycin tromethamine. For alkaline urine, sino naman po yung may alkaline urine? We have hyperventilation, we have vomiting, we have renal tubular acidosis, we have presence of urease producing bacteria, vegetarian diet, and old specimens po. Next, for number 95, urine of a patient with orthostatic proteinuria. Again, urine of a patient with orthostatic proteinuria. Okay, ano ping answer natin? Specimen 1, by the way, is for first morning urine. specimen 2 after remaining in a vertical position for several hours. Okay, by the way, ang question po pala, sorry, which is true. Is it letter A? Both specimens will yield positive results for urine protein. Next, both specimens will yield negative results for urine protein. Letter C, specimen 1 is positive, specimen 2 is negative. Letter D naman, specimen 1 is negative and specimen 2 is positive. Correct answer po is letter D po. Again, correct answer po is letter D for number 95. So remember po, the first voided morning urine specimen is particularly valuable po because more concentrated po siya and abnormalities are easier to detect po. Hindi pa po siya diluted din. So an early morning specimen is also relatively free of dietary influences po and changes due to physical activity. Specimen 1 po is negative po of protein po. Now remember na one cause of orthostatic proteinuria po is prolonged standing. So definitely urine protein levels po are increased po. So specimen 2 is positive of protein po. For number 95, letter D. Number 96, xanthochromic CSF is an indicator of what? Again, xanthochromic CSF is an indicator of, is it letter A, bacterial meningitis, letter B, increased pressure of CSF, letter C, increased protein of CSF, letter D, cerebral hemorrhage. Again, xanthochromic CSF po is an indicator of, correct answer po is cerebral hemorrhage po. Number, now just in case, nakalimutan niyo din po, okay, we have, how do we differentiate between traumatic tap and intracranial hemorrhage po? Remember po, for traumatic tap, okay, there is uneven distribution po, okay, ng blood sa each tube po. Okay, so sa tube 1 po, greater po than tube 2 and greater than tube 3 naman po yung tube 2 po. So again, uneven distribution of blood sa tubes po for traumatic tap. For intracranial hemorrhage, even or uniform ang distribution po ng blood sa each tube. So 1 is equals to 2 is equals to 3 po. The tube 1 is equals to tube 2 is equals to tube 3 po. And we also have clot formation po, remember, is present for traumatic tap, negative naman po for intracranial hemorrhage po. And we have yung supernatant fluid po. Remember po, for traumatic tap, clear po yung supernatant fluid, but sa cerebral hemorrhage or intracranial hemorrhage po, may color po yan, yung supernatant, that's xanthochromic po. And then we have erythrophages po, absent po yan sa traumatic tap, and present naman po sa intracranial hemorrhage po. And for D-dimer, remember po, for cerebral hemorrhage po, that's D-dimer, positive and negative naman po for traumatic tap po. Okay. Next, for number 97, very viscous synovial fluid may be pretreated with, anong answer po natin? Again, very viscous synovial fluid may need to be pretreated with, is letter A, acetic acid, letter B, alpha-chymotrypsin, letter C, hyaluronidase, or letter D, normal saline. Again, very viscous synovial fluid may be pretreated with, pilot naman po ng very viscous, that's hyaluronidase po. So again, very viscous synovial fluid may need to be pretreated po by adding 1 drop of 0.05% hyaluronidase po in buffer po per ml of fluid. And after that po, in-incubate po yan at 37 degrees Celsius for 5 minutes po. For number 98, which of the following reagents is used in the mucin clot test po? Again, which of the following reagents is used in the mucin clot test? Okay, is it letter A, acetic acid, letter B, potassium iodide or iodine, letter C, sodium hydroxide, or letter D, trichloroacetic acid? Again, which of the following reagents is used in the mucin clot test po? Is it, that answer po is letter A, acetic acid po. So remember po, viscosity po of synovial fluid po is also examined by looking at clot formation po. And this indicates presence of fibrinogen po. Pag na-damage ang synovial membrane po, or pag may hemorrhage po, or blood contamination po during a traumatic tap po. And this test po is referred to as the ropes, again, ropes or mucin clot test po. And it is performed by adding synovial fluid to a 2% to 5% solution of acetic acid po. So in ropes or mucin clot test, remember, formation of a solid clot indicates good viscosity po for number 98 letter. Next, for number 99. Which of the following is a test for fetal lung maturity? Again, which of the following is a test for fetal lung maturity? Is it letter A, acetylcholinesterase, letter B, alpha-fetoprotein, letter C, phosphatidylglycerol, or letter D, optical density at 450 nanometer? Again, which of the following is a test for fetal lung maturity po? Letter A, acetylcholinesterase, B, alpha-fetoprotein, C, phosphatidylglycerol, or letter D, optical density at 450 nanometer po. For number 99, that's letter C, phosphatidylglycerol. Remember po, acetylcholinesterase po and AFP po, they are test for neural tube defects. Again, test po sila for neural tube defects. Alpha-fetoprotein po, okay, is the screening test, and acetylcholinesterase po is the confirmatory test po for neural tube defects. And we have optical density at 450 nanometer or OD450 po is a test for hemolytic. Yan po. Again, test for fetal well-being and maturity po. We have HDN po, test for HDN. We have OD450, test for neural tube defects. Again, that's AFP as the screening test, and acetylcholinesterase po as the confirmatory. Under fetal, test for fetal lung maturity or FLM, we have LS ratio, we have amniostat, FLM, we have FSI or foam stability index, and micro viscosity test po. And test naman for estimate of fetal age is creatinine po. Again, creatinine. Next, 100, amniotic fluid from expectant mother in the 39th week of gestation gives these laboratory results. Given, LS ratio po of 4, creatinine po of 2.8 mg per dl, delta 450 of 0.008, and zone 1 sa Liley graph. Okay, ano pa yung answer natin? Okay, choices. Is it letter A, inadequate fetal kidney function? Letter B, intrauterine hemolysis. Letter C, mature fetal lungs. Or letter D, small fetal body size. So remember po na yung significance po, okay, of the, ano yung answer po natin again, sorry, that's letter C po, mature fetal lungs. Significance of the lecithin-sphingomyelin ratio as a determining factor in fetal lung maturity is well established po. And remember po, an LS ratio, pahighlight na lang po nung given na LS ratio, tama, 4. An LS ratio po of greater than 2 to 2.5 is indicative po of fetal lung maturity po in most assays. Now, the fluorescence polarization method po of less than 0.320 has been associated din po with fetal lung maturity po. And presence din po ng phosphatidylglycerol sa amniotic fluid has been related to fetal lung maturity at absence po ng tinatawag nating respiratory distress syndrome po. So there you have it for your pre-test. I hope you learned something. Thank you. Over and out.